Good day, my friends, and you're welcome back to the channel. Remember to like our content, share our content, and subscribe to our channel. It's always wonderful to have you here. Now, for today, we'll be discussing epidemiology, clinical practice, and approaches to prevention. Epidemiology, clinical practices, and approaches to prevention. Now, like I said, and I'll say it again, what's epidemiology? This is a study that looks at the determinants, causes, distribution, risk factors of a disease. So an epidemiologist is basically a disease detective. He wants to look at a disease and find out what's the cause of the disease, where is the disease located, what's the spread like, who are the people that are at high risk towards getting this disease. And these are all the things that the epidemiologist looks at. And it is a very important part of epidemiology. Now, prevention, epidemiology is very heavy on prevention, and prevention is very important to epidemiology. Now, like we had earlier said in some of our videos, we talked about the different types of prevention. We said there's primary, secondary, and tertiary prevention. You can check out our other video to learn about that. But today we're going to look at the approaches to prevention. There are two major approaches to prevention. There's what we call a population-based approach and a high-risk approach. Population-based approach and a high-risk approach to prevention. Now let's take it one by one. The population-based approach is the approach in which the preventive measures are geared towards or tailored towards a population, a large population. Advice, screening, or whatever intervention is done on the basis of the population is done for the whole population. Look at an issue such as immunization now. When you do immunization and you do immunization for perhaps under 5 children in the whole of Nigeria, such an approach is a population-based approach. It's looking at the whole population of under 5 children and you are immunizing all of them to prevent them from coming down with the disease. When you have mass media campaign, when you have health education talks, mass media campaign, and you are trying to improve people's lifestyle, diet and all these things, all this that you are doing is just to, give intervention that is for the whole population. Is based on the population, and intervention is to make the population healthier. Now, the second approach is a high-risk approach to prevention. And the high-risk approach to prevention is different from the population-based approach, because in the high-risk approach, what happens is that there is a targeted population, meaning that the intervention works in such a way that it seeks out those who are really at risk of having whatever illness it is, and then performs measures for that particular population of individuals. Those high risk individuals are the focus of the intervention. For an example, if there is obesity in a country and they begin to target cholesterol levels of teenagers or cholesterol levels of young children. Now, every young children with an elevated cholesterol level can be, identified, and then interventions can be done on such a child. That kind of approach is a high risk approach. It's an approach where you seek out individuals who are at risk of having this illness, and then the intervention is done on them. Now, the high risk approach can be expensive because time has to be taken to look for these individuals, and then sometimes some measure of invasive practice, invasive diagnosis or invasive procedures have to be done on that individual to make sure that that individual is actually a high risk individual, and then the intervention can be done. Now, epidemiology is also important in clinical practice. We've said this before, but let's just quickly round up this video by saying that epidemiology plays a role in clinical practice, and one of the roles it plays is to help in prognosis of disease. Based on data that is gathered about a disease, epidemiologists are able to tell what is going to be the outcome of a disease. Based on the fact that they gathered data from many other people who have suffered from this disease, epidemiology can tell, and epidemiologists can tell the direction in which a disease is heading, the stages of the disease, and what could likely happen after the disease gets to a particular stage. Now, thank you for listening to this lecture, and have a wonderful day.